So many people would ask, what's the difference between autologous stem cell and allogeneic stem cells? So autologous stem cells are obtained from your own body. So the procedure itself is considered a tissue transplant because we get mesenchymal stem cells from your own bone marrow or your fatty tissue, and then you isolate the mesenchymal from the bone marrow or fatty tissue and re-inject into your body. For allogenic stem cells, it comes from a donor, so it's from outside of your body. And the umbilical cord stem cells we use as stem cell therapy experts are from the lab expanded umbilical cord and from healthy donor. So these cells are not from your own body. A natural question from many people is whether these cells can trigger immune rejection in your body. The answer is no. These type of cells are immuno-privileged. That means they do not have the receptor on the cell surface to trigger any immune response when they enter your body. And on the contrary, they are actually very good at regulating your body's immune system. That's the reason why these type of mesenchymal stem cells from umbilical cord from a donor is superior in treating autoimmune conditions. And one of the FDA-approved procedure using mesenchymal stem cells is to treat graft versus host disease in organ transplant. Because there are people after they get organ transplant, even though they are on immunosuppressive drugs, they still get rejection to the transplanted organ. And some people, they actually fail the transplant because they are already resistant to the immunosuppressive drug, and then they still eventually have the organ failure for the transplanted organ. So these type of umbilical cord mesenchymal stem cells can be used to treat people with this type of rejection, even though the regular immunosuppressive drugs do not work for them anymore. So that's why these type of cells, they are very good at regulating the immune system so that they do not attack your own body's tissue or attack any transplanted organs.